Hi everyone, I want to talk about May-Thurner syndrome. May-Thurner syndrome is a lower extremity problem. This is associated with iliac vein compression and mostly at the left iliac vein compressed by the right iliac artery. It increases the vein thrombosis in the left lower limb. You're going to come across some terms like venous spur, which could be central, lateral, or fenestrated. You're going to come across something like Cockett syndrome, or iliacaval venous compression syndrome, or iliac vein compression syndrome. They are all pointing to the same thing. The left common iliac vein is comprised by the right common iliac artery. That would be compression against the fifth lumbar vertebra. On the right, though less common, you can also have inferior venacava being comprised, and that will be by right common iliac artery. The symptoms will be essentially that there will be swelling, pain, warmth, redness, varicose vein, and possibility of pulmonary embolism. You can check my channel for full presentation on pulmonary embolism. There's possibility of chronic venous insufficiency, venous stasis, and with associated ulcer or pelvic congestion syndrome. And with pelvic congestion syndrome, the woman will complain of dysmenorrhea, pelvic pain, varicose veins, vaginal or vulva swelling, and so on. Symptoms will also continue as claudication, hyperpigmentation, retroperitoneal hematoma, secondary to prostatic enlargement, or cryptogenic stroke in those with patent foramen ovale. The associated risk factors will be essentially back to the basis, Varicose triad, that is stasis, and the stasis here could be as a result of dehydration or increased viscosity, and endothelial injury with hypercoagulable state. When all these are present, that is Varicose triad, and that will be pointing to formation of thrombosis along the vein, named as the vein thrombosis. Other associated risk factors with May-Thurner syndrome could be the gender, being a female, on combined oral contraceptive use, multipara, postpartum, or scoliosis. The diagnosis could be done through CT venography, magnetic resonance imaging venography, intravascular ultrasound, or duplex ultrasound. The differential diagnosis here are pretty tricky because it's not straightforward. It's made based on possible causes. In other words, the source of the compression would then be what we tag as the possible differential when it comes to May-Thurner syndrome. So when we have May-Thurner syndrome, then we'll start asking ourselves, are we dealing with pelvic tumor, any pelvic hematoma, any pelvic abscess? Is this individual pregnant and with enlarged uterus? Any fibroid here? You can check my channel for presentation on pregnancy and fibroid already. I published a lot on them. Iliac aneurysm, osteophytes, or lymphedema. How do we treat? The treatment here is generally the way we treat DVTs. Please check my channel for presentation on DVT. I think I have about 2 of them, and one of them will contain the treatment. Venacava filters could be put in place to prevent pulmonary embolism, because that's going to prevent the thrombus and, if possible, the embolus from ascending up into the pulmonary artery and causing pulmonary embolism. Angioplasty is a possibility with venoplasty and stenting. And after catheter-aided balloon distension, you can get that done. You can administer thrombolytics after ruling out contraindications and making consult with specialists, and you can administer that via catheterization. And with that, I come to the end of presentation of May-Thurner syndrome. Kindly subscribe to my channel so that you can get my presentations immediately they are published. Thank you.